promotion team at Action Canada for Sexual Health and Rights. We are a national organization working to uphold and advance sexual rights, including reproductive rights. Sex ed is one of our biggest priorities. When people think of sex ed, they think of health information that is necessary to help us make health decisions, taking care of ourselves, prevent sexually transmissible infections, etc. It's not always understood as a tool to prevent violence, but it's one of the main interventions we can do to actually have long-term impacts on violence rates in Canada, including domestic violence, intimate partner violence, and gender-based violence. That's because we are working with young people to develop on the long term, some sophisticated understanding of gender equity, of how to have healthy relationships, developing more knowledge around consent, and to disrupt some romantic and sexual scripts that fuel epidemics of violence across the country. Because it's one of our priorities, we read, or I certainly do read, all the studies that come out on this topic, and there's so much to know about this and why it's such an important thing to rally behind. So one of the studies that is very informative on how sex ed can be used as a tool to prevent violence came out of the Harvard Education Department. So it's called Making Caring Common, and that group of professors and students ran surveys with students of the university to understand what kind of interventions could be done to have better sex ed. And what came out of this were really interesting findings. So first of all, students want to know how to have healthy relationships, and they also shared that parents and educators have not been talking to them about how to do that. And that has had long-term impacts on rates of violence, on health, and other really important social outcomes. So there is an opportunity there to address what is a lack of education around really lifelong skills that we all need. It was also found in that study that there's high rates of misogyny still in terms of attitudes that students shared with the researchers. So we often think that we're going to age out of sexism, we're going to age out of racism, and basically we're getting to know that that's not the case. So young generations are still have beliefs that continue to uphold problematic scripts when it comes to sexuality, when it comes to relationships. And they are not being taught how to avoid sexually harassing others, avoid creating relationship dynamics that lead to violence. And so again, this is talking to the opportunity to talk to young people about toxic masculinity, about consent, about sexual scripts, about what a healthy sexuality looks like, what does a healthy relationship look like. We talk to young people across the country about their sex ed, and many of them share that they want to know things like how to break up, how to fight in a healthy way with their partners. What does a healthy relationship look like? What does an unhealthy relationship look like? And so we are seeing that young people have an appetite for that kind of information, and sex ed is a way to scaffold information to develop really sophisticated understanding of how to be together in a way that upholds everyone's safety and everyone's rights. So this is something that's important for different sectors to rally around. So public health should be working with the anti-violence sector, should be working with sexual rights sector, we should all be working together to make sure that the sex ed young people get is one that can equip them to live healthy lives and thrive. And this includes how to navigate healthy relationship, how to not harass others, how to have gender equitable norms, and how to ensure gender equality in the future. And this is also to help us make sure that we protect young people from sexual abuse, we help them make sense of experiences they may have, we ensure to create trust between adults and young people around these issues of violence and sexual violence. And so, we hope to continue creating a group of advocates that will continue pushing for this really important intervention to prevent violence in Canada.